Hi gang, Dr. Manko here again with the 6th video in the wellness series. One of the most common questions that we get in practice is, Doc, which way should I sleep? And I always have a very similar answer, and that is whichever way is the most comfortable, except we just know that stomach sleeping can be a challenge for a lot of you because some of you have some injuries of the spine that don't allow you to turn your head and to move properly. So you may lose movement because of the structural shifts or the injury. So that's why stomach sleeping and the lower back, it can bother you. So that's the one I don't recommend too much at all. And people are a lot more comfortable on their side or on their back, right? Unless you're a snorer and your wife tells you don't sleep on your back, then you may have some other issues. But there are many things that affect sleep, not just the physical parts of your body. Caffeine. If you drink coffee after 3 o'clock in the afternoon, some of your livers don't detoxify the caffeine, and it can be in chocolates as well. So that may be a process where it lingers for you, where you can't sleep. Alcohol. Alcohol puts you to sleep quick, but you don't have deep sleep. So you're up quite often through the night because it inhibits that process. Visual stimuli. There's so much technology today that people use iPads at night to reading, and that's one of the ways you inhibit the production of the sleep hormone melatonin. So at least 3 hours before bed, you shouldn't be having that direct stimulus into your vision. Okay. Then we get into the physical parts of the body. I brought this pillow out here, and there's people ask me what's the best pillow. The ones I've been using for years, I like myself. There's two in the office. This one here, if I recommend it for you, it means that your spine is able to adapt. It can be supported in its proper structure. So in the cervical spine, there should be this C-shaped curve, which you can't tell by looking on the outside of it, but on your x-ray, we know that it has a reverse C-shape, like and a curve that we call lordosis. When you're on the back, sometimes these pillows are so big that you end up losing the curve. So if I lie on my back and I have a big pillow, my dad does this, he's got a big pillow, his head's up like this, okay? And then sometimes it's too small of a pillow. So when you're sleeping on your side and the pillow's too small, my head deviates outside of the alignment of my body. So we want to have a pillow that can be conducive to supporting the natural neck curve as well as supporting the front part of the alignment of the spine. So these pillows, the Therapeuticas, they have a nice cervical support for the centerpiece, and then we turn it to the side, and the side it's actually, we use a tool to actually measure the distance between your neck and your shoulders. And that tells us the sizes, because not all the sizes are for everyone, because we have different sizes of our body. So on the back, we're going to sleep on parts to support the curvature, and then when we roll onto the side, it actually keeps our neck in midline. So this is kind of what it looks like. So we have a nice support for the cervical curve. Feels fantastic. And then typically if I roll on my side at night, I then end up on the wing. And now my neck is in midline to the rest of my spine. It's not deviated to the left side or too high. And that's why we measure you to make sure that the distance from the shoulder to the neck is in this pillow is the right size for you. So that's kind of the sleeping postures. It really takes a lot of stress off the nervous system. You tend to find people sleep better, don't wake up with numbness in their hands and headachy and stiff necks. So proper postural support during sleep is a wonderful thing, and your body will love you for it. So the Therapeutic pillows are fantastic. Next time you're in the office, ask one of my team members to size you up to get one of these for you because they work wonders. Some people who have some significant damage of the neck or degeneration, sometimes this support pillow is a bit too much, so we have a water-based pillow in the office that we more recommend that's more easier to support that way for you. So I hope that's some helpful tips for you for sleeping processes because it's an important part of the healing process, and I look forward to seeing you on your next visit. Bye for now.